Hello, my name is Dr. Sarah Cortright. I am a small animal veterinarian, and today I'm going to be looking at some of the most searched topics about your dog's gastrointestinal issues. The first question is, my dog has diarrhea. So this is a very broad question. Dogs can have diarrhea for a number of different reasons. Sometimes it's from infection, maybe they got into something, had a new food or treat. So there's not really an easy answer to this question. The most important thing to do is really to get a thorough history of what has your pet been doing for the past couple of days. Has there been any new foods, any new environment, anything that may have stressed them out? This is all very important information to bring to your vet when you take your pet in. My dog keeps throwing up. So there are, again, a number of reasons why your pet could be vomiting. Again, some important things to consider: were there any changes to their diet? And really important with vomiting, is there any chance that they could have swallowed something inappropriate? If that is a concern, make sure you bring your pet to the vet immediately. Sometimes we'll want to take x-rays and make sure that there's nothing stuck or lodged in the intestinal tract. Some things that you can do to really make them comfortable in that situation: make sure they're in an environment away from other pets or even other people in the household. Also putting them in an area that it's easy to clean up. After that, really taking account of what has happened recently. Has there been any new food, any new treats, any stressors? Did they chew apart any toys? That can also be crucial because we want to make sure that they didn't consume anything inappropriate, especially toys or anything that could cause a physical obstruction in their gut. However, if your pet is vomiting multiple times in a row or multiple days in a row, it is always best to get them checked out by your veterinarian. My dog is constipated. So constipation is actually something that is fairly uncommon in our dogs. What is more common is to actually see something called tenesmus or straining, and that's actually related to diarrhea. So if you are seeing this, again, something very important to do is take an account of the history for your pet and what has changed recently. Make sure you're bringing all of this information to your vet. Usually this is not an immediate emergency, but if you are noticing it over multiple days in a row, you should definitely be taking them in. My dog has no appetite. So if your dog is suddenly refusing to eat, you should bring them into the vet immediately, especially if you have a young, otherwise healthy puppy that's eating one day and then the next is refusing to eat. That can be a very concerning clinical sign that something much more serious is going on. My dog has bloody diarrhea. So bloody diarrhea can be an indicator of a much more serious illness. This is something I would not wait. I would take your pet to the vet immediately. Something really helpful though is before you go, if you can bring in a stool sample for them, that can at least help us start to run some initial diagnostics, like a fecal test for intestinal parasite screening. Sometimes we may also have to do things like x-ray or blood work to rule out the different potential causes of why your pet is having some bloody stool. My dog has hiccups. So just like us, dogs can get hiccups. It's actually something that is much more common in puppies because it has to do with the muscle of their diaphragm just kind of starting to work for the first time. However, if this is happening in an older pet and you are seeing any other changes or concerns, make sure you let your vet know right away. Something else that's really helpful for us as vets is for you to record a video of the behavior because that allows us to see exactly what you're seeing at home. It's a lot easier than you trying to imitate it. Do you have any more pet questions? Make sure you comment below and I'll look to answer some of them.